Hepatic encephalopathy. It is a condition characterized by an alteration in mental status and cognitive function occurring in the presence of liver failure, may be acute and reversible or chronic and progressive. Pathogenesis. It occurs as a result of a biochemical dysfunction in brain function caused by the presence of various toxic substances reaching the brain. Normally, these toxic substances are produced in the intestine and transported to the liver via the portal circulation for detoxification. They are not supposed to enter the systemic circulation or reach the brain. However, in hepatic encephalopathy, 3 factors contribute to the entry of these toxic substances into the brain. 1. Severe dysfunction of hepatocytes of liver cells, leading to impaired detoxification. 2. Shunting of portal venous blood into the systemic circulation, bypassing the liver, both within and outside the liver, collaterals, allowing toxins to enter the systemic circulation. 3. Increased permeability of the blood-brain barrier, enabling toxins to cross into the brain. The most important toxic substance involved in hepatic encephalopathy is ammonia. There are several precipitating factors for hepatic encephalopathy, including gastrointestinal bleeding. This leads to increased production of ammonia and other nitrogenous substances in the gut, which are then absorbed and carried to the brain. Increased intake of dietary protein. Intestinal bacteria act upon dietary protein, resulting in excessive production of nitrogenous substances. Electrolyte imbalances, such as hypokalemia and hyponatremia. Large volume paracentesis. Vomiting and diarrhea. Overuse of diuretics. These factors precipitate hepatic encephalopathy by causing electrolyte imbalances, particularly hypokalemic alkalosis. Other factors that can contribute to hepatic encephalopathy include acute infections, uremia, sedative use, constipation, viral or alcoholic hepatitis, surgical shunts. Clinical features: confusion, slurred speech, change in personality that can include being violent and hard to manage, being sleepy and difficult to arouse. Asterixis or flapping tremor is the most characteristic neurological abnormality. It is best observed by having the patient extend their arms and dorsiflex their hands. It manifests as rapid flexion-extension movements at the metacarpophalangeal and wrist joints, accompanied by lateral movement of the digits. Other conditions associated with flapping tremor include uremia, respiratory failure, and severe heart failure. Patients can progress to coma, initially responsive to noxious stimuli, later unresponsive. Investigations: blood ammonia levels are elevated. Electroencephalogram, EEG, shows characteristic delta waves, which are symmetric, high voltage, slow waves, 2 to 5 per second. Cerebrospinal fluid. Normal proteins. Increased glutamine. Normal cell count. Liver function tests. Treatment involves removal of the precipitating causes, correction of electrolyte imbalances. Lactulose, a non-absorbable disaccharide, is the mainstay of treatment. It acidifies the colon and induces diarrhea, aiming to produce 2 to 3 soft stools per day. Lactulose reduces ammonia production by altering bacterial metabolism. Poorly absorbed antibiotics, example oral neomycin, are used in patients who cannot tolerate lactulose. Neomycin also reduces intestinal ammonia production by bacteria. Its main side effects are nephrotoxicity and ototoxicity. Alternatives to neomycin include metronidazole and rifaximin. Zinc supplementation may be helpful in some cases. Liver transplantation is considered when indicated. Thank you for watching. Don't forget to like and subscribe to the channel. See you in the next video.